My name is Ridge Salter. I'm a family physician here in York. I work for WellSpan Family Medicine at Hayshire in the north end of York, and I've been in that role for 22 years. We actually came here for training, knowing that York was a really strong area for developing family physicians and a welcoming area for them, and have found a real home here and a great place to raise a family, and have stayed. The last 7 years I've been in an administrative role. I work now with 11 different family medicine practices as their physician liaison, if you will, and we focus on things like quality and patient experience and all the things that are kind of important. But a big thing that I do is I'm considered the physician lead of our well-being efforts. So I really do a lot of administrative work in figuring out how we can best take care of our health caring professionals, especially our physicians and APPs. Burnout has been an issue in medicine for a good decade, maybe even longer, maybe 15 years or more, that we've realized that it's really a grind for our physicians, APPs, or nurses to do this sort of work. And all of that, which was existing before the pandemic, has been exacerbated by the pandemic, and it's made it even tougher. If there's a silver lining to the pandemic, it's really brought attention to the well-being of our health caring professionals. We know that this is really tough work, and if they're not well, like I said before, it's going to be really hard for them to take great care of our patients. So I find that work very fulfilling, because having been through the fires of burnout a few years ago myself, which is what led me to this role, I find it incredibly important, and I want, my colleagues to not have to go through that. And if they are, I want to try to give them the support so that they can, reach the professional fulfillment that they had hoped they were going to achieve. It's been really energizing work for me. I feel like that is in part my calling now, to figure out how I can make the work lives of my colleagues better. And it is a bit counterintuitive to think that I'm going to add one more thing and that's actually going to be good for me. But what do we know about burnout? There's lots of antidotes to it. You have to kind of get to the root cause. But one of the antidotes is, if in your life, if you're doing something you really feel is worthwhile, at least 20% of your job, you're going to achieve fulfillment. Your professional fulfillment will go up and your burnout risk will go down. And so what I've realized, that by adding this coming to Katallasso 1/2 day a month, has actually improved my fulfillment in my work rather than detracted from it, because I find great value in doing so. I was talking to Ed Nelson, who was serving here, and he's like, you gotta come check it out. And it was sounding very appealing to me, but I just, especially with my new administrative role, I just didn't have enough time. But then a neighbor of mine, Bill Kraft, who served on the board here, invited me to a Katallasso breakfast. It was really eye-opening to see what God was doing here. And I just felt the pull of God saying, you gotta do this, you gotta figure out a way to do this. And so I looked at my schedule, I figured out a way to say, you know what, I can do this a half day a week. And I found it professionally fulfilling for me. When I look at my packed schedule, and I see my Katallasso half day on there, I selfishly think to myself, I don't have time for this. Yet, at the end of the day, after my Katallasso session, I come home, have dinner with my wife, and we reflect on the day. What was the best part of your day? It's always that I served at Katallasso today. I felt like I was really needed there, and I was really appreciated. So in that way, it's added to my professional fulfillment, and I believe is one of the factors that is kind of an antidote to my burnout. There's been many times where patients have just looked me in the eye and just genuinely said thank you for helping me, for being here, for walking this journey with me. And we do get the ability to see patients back and form that relationship here, which is really, really pretty neat. So when I reflect on why we do this, I feel like I'm in part answering the call that Christ had to us in Matthew 25, when he said, when you're caring for the least of these, my brethren, you're caring for me. And when I get done with my sessions in Katallasso, I feel like I'm answering that call.